1450, FM 99.3 KNSI. Welcome back to another edition of Your Health, produced in conjunction with CentraCare. Today's guest is pediatrician Dr. Jill Amsberry. And in the next 20 minutes or so, we are going to talk about your children, oddly enough. Well checks, sports physicals, why they are so important, what moms and dads can learn at these visits. Dr. Amsberry, great to have you back again.
Thanks again.
When it comes to you specifically, and I love to talk to moms and dads about their kids, especially if they happen to be doctors, I think you have a little bit of an insight, but yet you are still a mom, right? At the core of everything, you're still a mom. You have a 4-year-old, you have an 8-year-old. Doesn't it scare the bejeepers out of you thinking about these kids going out and, playing organized sports, football or whatever?
Yeah, it is really, it's interesting, particularly with all the data that we know about play. I do worry about some of the structured activity at such an early age.
Well, play is so important.
It is.
But when you talk about structured activity, sometimes the kids need to just be left alone to play, right?
Absolutely.
Can you talk about that a little bit when you say you are a little concerned about the structured activity?
Yeah, there's good evidence that shows that in those early toddler years, particularly the kids who are less than 5, structured sporting activity isn't that beneficial for their growth and development.
Okay.
It's much more important that they're out free playing, exploring their environment.
Using an imagination?
That's right.
Well, what else can you tell us about that type of that time in a child's life, what's going through their head, and why being able to do hand-eye things and play and run and jump around and roll in the dirt, it's also important, isn't it?
It is. It's so important. So those first 3 years in particular, but really even up through the first 6 years, there's just rapid brain development. Mm-hmm. So the more that they're able to explore and interact with their environment, the more brain development that we see.
Everybody always talks about, when I was a kid, we left the house at 8 o'clock in the morning and we had to be home by the time the streetlights came on, right? Now, those times probably are gone.
Yep. I
would say. When it comes to being concerned about your child's safety when they are out there playing, what do you do?
Yeah.
What can you tell moms that may, they're either helicopter parents or they're the exact opposite, right?
Yeah. So I prefer to be a lighthouse parent, and that's not my own term. It's a term.
What is a lighthouse parent?
So I prefer to be someone who's there when they need me, so that I'm available and present when they need me. But I don't need to be over them all the time.
What would you suggest to moms and dads that are helicopter parents? Yeah. I have one of my daughters is a helicopter mom.
Yeah.
Right?
Well, I understand, right? So parents are just trying to do the very best that they can. And so I understand where that comes from. And it takes effort to, remove yourself and allow your child to interact and play and learn from those experiences, those natural experiences that they'll have through play without their parent guiding that.
How about, we talk about this free time where kids can just go out, use their imaginations. Let's talk a little bit about cell phones and screen time and that kind of stuff, because in my opinion, that takes all that away.
It does. It really does. And, like we mentioned in the previous screen time segment, we know that the 3-dimensional learning is so much more important than that screen, that 2-dimensional learning. And so when a child is able to hold a ball, throw a ball, bounce a ball, and touch a ball, they get improved brain development from that in comparison to the screen.
The whole sensory thing.
That's right.
Think about it, guys, gals. You're using your eyes, you're using your hands, you're using your body. Everything is interacting and connecting.
Right.
So much better than if you're doing a screen. Let's jump back over to these well child checks now. I recall very well when my daughters were little, we had healthy child or wellness checks on a particular schedule. That schedule is kind of important because, if I'm not mistaken, it has everything to do with developmental things that are going on with your kids.
Exactly. There are many things that we can identify on a yearly physical that parents don't always identify at home. So things like development, growth, even subtle nuances in, physical exam that you may not notice as a parent that the person who sees your child once a year may pick up on.
Well, plus you're looking through those doctor eyes.
That's
as opposed
right.
to a mom, right? You would mention sometimes we don't see things. Is it because we are there all the time and we don't notice these little changes, whereas every 6 months, 90 days or whatever? Well, let me ask, what is the What is the time frame for these well child checks?
Great question. So typically what we see is we'll see a newborn visit, and then again at 2 weeks, then 2 months, 4 months, 6 months, 9 months, 12 months, 15, 18 months, and then 2 years. We have a new well child check at 30 months that we're now recommending.
Okay.
And then again at 3, so 36 months. After 3, it's yearly.
Okay, and obviously if mom or dad notices something's not right, boom, get in to see the doctor.
Yes, obviously you can always come in sooner.
Interesting, the whole well child check. I will throw this out, and I bet your grandparents did not have well child checks, did they?
Right. I don't remember going to regular well child checks either.
Yeah, me either. Do you think it is much better that we are keeping an eye on the growth and development of our children, or, as it was in the old days, just let them go?
Yeah, it's very important, actually. And it's very important to have a medical home, someone who has consistently seen your child over the years. So when there are those subtle nuances, they can pick up on that. Or when you come in as a parent and you say something seems off, the provider can, corroborate that.
AM 1450, FM 99.3, KNSI. Our guest this morning, pediatrician Dr. Jill Amsberry with CentraCare, and you are listening to Your Health. We'll be right back. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Our guest, pediatrician Dr. Jill Amsberry with CentraCare. When kids come in for their well child checks, what kinds of things do you look for as a pediatrician?
There's a variety of things that we do within a well child check. And depending on the age, we'll look at hearing and vision. So some of the older kids will get hearing and vision evaluations. We'll look at developmental assessments to see if the children are meeting their developmental milestones. We'll look at emotional assessments for both the child and at certain visits for the parents as well, to make sure that there's good emotional health within the family. Then obviously we'll do a formal physical exam looking at, head to toe, eyes, ears, knees, and toes, right? And then we also look at preventative measures. So we discuss prevention depending on the age.
What is the difference between a sports physical then as opposed to just a regular well child check?
Yeah, so we as pediatricians recommend that that anyone that's getting a sports physical include that in their well child care. So what it means in addition to a regular well visit is that you'll get a questionnaire that will ask about specific history questions. For example, is there a family history of heart disease? Is there anyone that died of sudden death at a young age? Are there rhythm problems of the heart? We will also ask the children, have they experienced any shortness of breath when they're exercising? Have they ever passed out while exercising? So all of those questions would be additional questions that we would ask for a sports physical.
I can see where talking with a younger child, right, mom is or dad is going to answer all of those questions. But when you sit down and chat with an older child, maybe 10, 12, 13 years old, moms and dads are always in that room, right?
That's a good question. So for sports physicals, we typically do them at 7th grade, and then they're required every 3 years after that. So that is the age group that we're usually asking those questions.
Wait a minute. So if I have a kid that's in 7th grade, they don't need a sports physical again until they're a sophomore?
They usually don't need it yet. The state at this time requires it every 3 years.
Wow. I would think I would have it more than that.
But we do recommend yearly well visits still.
There it is. There's the caveat. What age do you think is a good age for active sports participation?
So
I think that's a big question because, come on, you're 5 years old. We've got to get going. We've got practice at 3 a.m.
Right. So the American Academy of Pediatrics does say that around 5 to 6 years, it's okay to initiate some participation in structured sporting events. Okay. Knowing that those children still need play, they need time to relax, and certainly it should never be more important than their schoolwork.
I'm sorry, what age? What age?
6 years.
6 years old.
Yeah.
You remember when you were 6?
Yeah, honestly, I did play soccer when I was 6, but it was mostly for the treats afterwards.
Yeah, sure. You just go out and knock it around, right?
That's right.
The organized skill drills and all of that kind of stuff.
Yeah.
Golly, I remember playing workup. We didn't have enough kids to actually have 2 sides for a softball or a baseball team, right? But riding bikes, we just go. Just make sure you're home by the time the streetlights come on.
Yep.
Golly, it was a great time to be a kid. Starting at 6 years old, but then what about, things like weightlifting? There are so many places that you're going to go, that your kids are going to go, that we never thought of going, where this competition thing is really going to start rearing its ugly head. Come on, Bob, you should be able to lift 200 pounds by now, right?
Absolutely. And unfortunately, that seems like that is starting earlier and earlier. I do get questions on some of my 5 and 6-year-olds who, where the coaches are actually recommending that they start lifting weights.
Oh my gosh, no way.
Right. And there isn't specific guidelines on that yet. My personal opinion is that I really like these kids to not feel like they need to be different than they already are.
Well, Doc, I've heard that, like with growth plates, that if you're out there lifting weights at too young of an age, that you can actually damage those. Yeah.
And again, there aren't clear recommendations on that, but just intuitively, it seems like that wouldn't be the right idea for so many reasons.
Yeah, golly. Let's look at the other side, though. I want my kid to be, starting as a freshman in high school, whether it's hockey, basketball, football, what have you.
Yeah, and I think parents need to ask themselves why. As we know, there's only a very small percentage of children who ever go into professional sports.
Yeah.
And what are these kids missing along the way? And we could talk about mental health, too.
Well, let's talk about mental health, because it's right up there. Everybody wants their kids to be a part of the team. Sometimes kids are not going to make that team. What do you say to that son or daughter? Hi, you're 12 years old. You've just been cut.
Right. I actually think that we can learn a lot from our failures along the way. So I think the most important part is when that child is cut from the team, that you're talking to them about that. What are you going to do?
What do you say?
Yeah. So number one, it's okay, right? It's okay. We still love you.
How is it okay?
For who you are, and that you are so much more than this sporting event, than this team. And there are a lot of different ways that you can have fun
Kids
and
don't
be
want
active.
to listen.
No, they don't.
Kind of like me right now. I'm sorry to interrupt, but kids just don't. They're shut down right now.
Right.
All my friends I'm gonna come back to school tomorrow. My name's not on that list, right?
We also have to wonder what we did in the first place to make them feel like that was that important. At what point, what did we, not just as parents, but what did we as a society do to make them feel like not participating is such a great failure?
Well, if you are going to have a son or daughter in sports, you probably need to sit them down and say, there may come a time that you may not make the traveling team. You may not make the squad, right?
Yeah. And also, there are a lot of great sports athletes out there that are examples of people who didn't make the squad, but are still, persevering regardless.
There are also other opportunities for those kids to play organized sports, whether it's some type of an intramural, whatever kind of league you want to find, church groups, right? Just because your son or daughter may not have made a team doesn't mean they can't make another team.
Yeah, and the most important thing that kids should know is that this is supposed to be fun.
It's supposed to be fun. Exactly right.
Yes, and we're supposed to be learning how to keep our bodies active in a fun way.
How to lose.
That's right.
How to win.
That's right.
Sports builds great character.
How to be a team member.
Right, right. AM 1450, FM 99.3, KNSI. You are listening to Your Health. Our special guest, pediatrician Dr. Jill Amsberry with CentraCare. One segment left, my friends. We are talking about you and your kids and athletics and participation. We'll take a quick break. We'll be right back. AM 1450 FM 99.3 KNSI. You are listening to Your Health. Special guest pediatrician Dr. Jill Amsberry with CentraCare is with us. We're talking about kids and, well, child checks and sports physicals and all of that, the necessity of having those regularly scheduled wellness checks. What about a sports physical? Like, I guess I don't really understand. If I'm having well child checks on a regular basis, why do I have to have a sports physical? What are you going to find in one and not the other?
Well, number one, the sports physical is required by the state. And if you're seeing your pediatrician regularly or your provider regularly, they will be including the sports physical at the appropriate ages when, we typically do that. So Sure. When you come in for your well check, we'll include the sports physical. Some people go off and do sports physicals in other areas where it's just the sports physical. If they do that, we recommend that you also don't forget to go back and do your well visit. And the reason is that your well check is going to include just the basics of your overall health, but the sports physical looks for sports specific things. So do you have any risk of heart disease? Is there a risk of, sudden death of on the field? Yeah. Do you have any musculoskeletal problems? Are we noticing any overuse injuries? So kids who just seem to be, doing too much. In girls, we look for their periods. Are their periods regular? Have they lost too much weight? All of those things are really important as we are evaluating a sports participating child.
Sure. And if your kid's not participating in sports, that's A-okay.
Absolutely. Yeah, just as long as they're staying active.
Well, first of all, Doc, I have to tell you, thank you for bringing up the female side of things, because it would never dawn on me, to think right. to think like that. Are there some specific other things that you need to think about if you have a daughter that is very athletic?
Absolutely. And we want to make sure that that adolescent is getting enough nutrition to be able to keep their body healthy in general, but two, make sure that they're continuing to have their regular periods.
Very good. Most important things right there.
Mm-hmm.
Okay. What about injuries, Doc? Kids don't really know, particularly younger kids, may not really be aware of how to communicate what's wrong with them to a doc.
Right. Yeah.
So what do we do?
Well, that's why the sports physical is really important. Okay. The other thing that can happen is the child may know that there's something wrong, but won't want to say it because they want to continue to participate in the sport. I remember that as a child when I was a cross-country runner in high school, and I had pain that I didn't want anyone to know about because I knew that it probably wasn't a good kind of pain and then would end up having me not run anymore.
Well, what do you think now, Doc?
I disagree with that theory, and I regularly have to tell kids that they need to take a break from sporting activities, and it's not an easy conversation. It's challenging.
I think at the beginning is the best time to have that conversation and lay out all of these scenarios, especially with your doctor.
That's right. Yeah, prevention is the key, right?
Well, you're so spot on. Kids are not going to want to not play, right? And a lot of times that's how they look at that competition is, I'm just going out to play some more.
Yeah.
Right?
Yeah.
As far as things that we should look for in our children, do you have, is there a top 5 list of things that you see in your practice every day in particular age categories that, and I guess I go back to the importance of those well child checkups. That's where you're going to catch this stuff.
That's right. Yeah. Yep. That's where we catch it. And, other things like scoliosis, you're not usually looking at your child's back, right? Mm-hmm. So, unless someone is actually having them do their formal scoliosis exam, you might miss it. And we might be further complicating or delaying treatment that could be
concussions
early.
Right?
Right, exactly.
I mean, my gosh, if you even suspect your child has been dinged, their bell has been rung, don't fool around with that. Brain injuries, I mean, wow.
Right, and the kids who are playing aren't always going to tell you that they just had their, quote, bell rung.
They may not even realize. Right?
Yeah.
I can't thank you enough for these conversations. The most important things, folks, well child checks, making sure that your children are old enough to participate. As the doctor, have you ever said to mom and dad, I don't think so?
Yeah. Most of the time, it's not mom and dad, it's the coach. that's pushing it. Mm-hmm.
You have a little message for coaches, perhaps? Back off a little bit?
Yeah, I mean, I just think that it's so important. Now, my husband's a coach.
Is this the mom or the doctor talking here,
right? This is a combination,
okay,
right?
Right.
And it's also the wife of a coach. So I say this, all the time, that people need to realize that sports are fun. They're supposed to be fun. And if you allow your child to enjoy them, they can be a lifelong form of mental and physical health. Don't ruin it.
Dr. Jill Amsberry, well said. AM 1450, FM 99.3, KNSI. You have been listening to Your Health with Pediatrician Dr. Jill Amsberry. Thank you.
Thanks again for having me.
AM 1450, FM 99.3, KNSI. Thanks for listening.